sallallahu ala habibihi Muhammad wa alihi wasallam. You are watching Mushtaq Ahmed Makhdumi YouTube channel. I am Mushtaq Ahmed. In this video, we shall discuss about the coronavirus, novel coronavirus. What is novel coronavirus? What are its symptoms? And we shall also discuss about its treatment. So stay with us.
Coronaviruses are named for the spikes that protrude from their membrane, which resembles a crown or the sun corona. They can infect both animals and people and can cause illness of the respiratory tract. The infection can range from the common cold to dangerous conditions like SARS, which sickened thousands of people around the world and killed nearly 800 during an outbreak in 2003. Middle East Respiratory Syndrome or MERS, first reported in Saudi Arabia in 2012, is also caused by the coronavirus. How dangerous is it? Recent news reports indicate that Chinese authorities measured doctors who were first recognized the new infection, and they may not have been fully transparent about the number of infection and death even after the alarm was raised. It is also not clear whether cause and death in China are being carefully tracked and reported. Diagnostic kits and other health resources have been in short supply in affected regions. Last week, the WHO said that while the majority of the patients with the new coronavirus have mild disease, 20% develop severe illness, including pneumonia, respiratory failure, and sometimes death. The WHO estimated the death rate among those infected at 2%. That's high as the death rate of the pandemic Spanish flu in 1980. Scientists don't know who is most susceptible to the new coronavirus. Does it pose to risk young healthy people or like seasonal flu? Is it primarily a threat to the frail and elderly and those with underlying health problems? Epidemics caused by the other member of the coronavirus family, SARS and MERS, have had high death rate, 10% for SARS and about 35% for MERS. Influenza like more people every year, but its mortality rate is only about 0.1%. The number of deaths is high because so many people become affected. Widespread coronavirus epidemics have the potential to take heavy toll, so the health authorities scramble to stamp them out. Healthcare workers are particularly vulnerable at a hospital in South Korea in 2015. One man with MERS transmitted it to 82 patients. How is it transmitted? The question is, how is it transmitted? Most respiratory viruses are transmitted through coughing and sneezing, but troubling new evidence suggests people who are infected with the new viruses may be spreading it before they even know that they have any symptom. Though the Chinese authority played down the likelihood of the human to human transmission at first, it has now become clear there is significant and sustainable transmission from person to person. Where did the new coronavirus outbreak start? On January 8, the New York Times reported that Chinese researchers had identified a new coronavirus as the pathogen behind a mysterious illness that had sickened 59 people in Wuhan. The case was linked to the market that sold live fish, animals, and birds. The market was later shut down and disinfected. Past outbreaks, similar illness, including SARS, are also believed to have emerged from the animal market. The coronavirus that caused MERS is transmitted to humans by camels. The animals that was source of the new coronavirus still not known, and the destruction of the Wuhan meat market has made the question nearly impossible to investigate. Bats are considered a possible source because they have evolved to coexist with many viruses, including coronavirus. But it is very possible the viruses were transmitted from bats to an intermediate animals and then to humans. What symptoms should I look out for? Symptoms of the viruses include fever, severe cough, and difficult breathing or shortness of breath. The illness causes lung lesions and pneumonia. Milder cases may resemble to flu or bad cold, making detection difficult. Patients may exhibit other symptoms too, such as gastrointestinal problem or diarrhea. If you have fever or cough and recently visited China or spent time with someone who did see your healthcare provider, call first so they can prepare for your visit and take steps to protect other patients and stop from potential exposure. Is there a test for the viruses? What is the treatment? In other words, what are the treatments? There is a diagnostic test that can be tell if you are infected. It was provided by the Center of Disease Control and Prevention based on genetic information about the viruses provided by the Chinese authority. Right now, tests are done by the CDC in Atlanta, but the agency plans to share the test with states and liberties as soon as it refined. The main treatment of the coronavirus is supportive care, including making sure the patient is getting enough oxygen and using a ventilator to push air into the lung if necessary. Patients should rest, and remdesivir appeared to be effective in animals and was used to treat the patient in Washington state. Chinese officials are also experimenting with at least one other HIV drug to treatment the infection. Drink plenty of fluid while the immune system does its job and heal itself. No drugs have been provided for any coronavirus disease, including the Wuhan coronavirus, though an antiviral medicine called genomics and improved global coordinations have allowed researchers to move at vaccine development remain an expensive and risky process. With each new outbreak, scientists typically have to start from start. After the SARS outbreak in 2003, it took researchers about 20 months to get vaccine ready for human trial. But the time of Zika outbreak 2015, researchers had brought the vaccine development timeline down to 6 months. Now, a coronavirus vaccine is still months away and perhaps years.
If you think this video is fruitful for the other people, then you share it, like it, and also subscribe our channel. Thanks for watching.